This is Dr. Aisling Whitaker from Bitehaus Dental in Toronto, and today I'll be introducing to you a system known as Healthy Start. Healthy Start is a sequence of appliances worn at night with the goal of improving sleep, breathing, and behavior for your child. The questions we ask the parents in our clinic: does your child snore, grind their teeth, wet the bed, wake frequently, or have signs of ADHD or daytime sleepiness? If so, these are symptoms of sleep-disordered breathing. When your brain recognizes that it doesn't get sufficient oxygen at night, it compensates by triggering fight or flight behaviors. The knock-on effect is missing out on stage 3 sleep, which is when the body and brain repair and regenerate. If your child is exhibiting these symptoms, we would like to help improve their sleep. We also ask, does your child mouth breathe, have chronic allergies, or have eczema? Another type of sleep-disordered breathing is mouth breathing. We know that nasal breathing is crucial for filtering viruses, bacteria, and allergens. As you breathe through your nose, you filter the air, warm and moisturize. Children who are mouth breathing and adults who are mouth breathing typically have much higher rates of chronic allergies, asthma, seasonal allergies, pet and environmental allergies, and eczema. Does your child suck their thumb, finger, or use a pacifier, or did they for an extended period of time, that is past 6 months of age? These oral habits can lead to incorrect swallowing patterns, tongue weakness, which has a knock-on effect to speech. They can narrow the arch shape, lead to an open bite where the teeth don't meet at the front, and increase the orthodontic need for your child later on. If your child is mouth breathing, there is a concern in terms of the amount of oxygen that is reaching their body and their brain. Mouth breathing will lead to increased tonsil size, increased illnesses such as respiratory illnesses, increased diagnosis of ADHD, depression, and developmental delay. And this is simply due to the lack of oxygen that the brain is receiving. If you have a look at the image on the bottom left-hand side, you will see the size of the oropharynx in the same child when they are breathing through their nose and breathing through their mouth. When the child is breathing through their nose, their oropharynx is about a half an inch in. When your child is breathing through their mouth, their oropharynx is more open, or what we call patent, and is similar to the size of a large bore straw. When this child has their mouth open and is breathing through their mouth, it actually collapses the oropharynx down to about the size of what they say a coffee straw, or the tip of a pen. As this child breathes this way throughout the night, you can see how restricted the airflow would be to their brain. On the bottom right, we want to draw your attention to the size of the oropharynx after 1 month of the Healthy Start habit corrector. So not only is the airway open and patent, but it increases in size based on the positioning of the jaws and the tongue over time as they are trained. Some signs that parents are very aware of: enlarged tonsils and adenoids, tongue thrusting, which could lead to speech issues, tooth wear, grinding their teeth, chipping of the teeth. They may have quite a small facial profile or an unequal or asymmetrical facial profile. They may have a tongue tie and lip tie. They may have a high vaulted palate, so very steep roof of the mouth. Often parents will notice dark circles under their eyes. Their child looks tired all the time. Or they may have behavioral issues that make the parent concerned about things like ADHD. I'd like to introduce to you the habit corrector. So a habit corrector is a nighttime appliance similar to a night guard. Both the upper and lower teeth fit into this appliance, and it has a shelf for the tongue as well as pressure shelves to push the roof of the mouth. This uses myofunctional therapy, which strengthens the tongue and trains nasal breathing. As the tongue is trained into the correct posture, this will also expand the roof of the mouth and the arches. So it's essentially myofunctional therapy all night long, which is physiotherapy for your tongue and oral tissues, and improving nasal breathing. Ideal time to start is anywhere from 2 to 3 years of age, and treatment time is anywhere between 3 months and 9 months to correct these habits. There is actually a habit corrector available for adults too, and typically we see parents of the children also going through therapy if they are mouth breathers. This child is an example of a very young child wearing the appliance. We do work up the wear time over time. It's not possible for very young children to wear it overnight straight away, but usually we find within a few weeks that your child is comfortably able to wear it at night, and they actually like it, especially if they have been pacifier wearers. After habit correction, if your child is above the age of 5, we can use a series of guidance appliances to guide the jaws and teeth into the ideal position while your child grows. This is taking a proactive approach to orthodontic growth and guidance rather than waiting until all of the adult teeth are in position and then correcting them. So the goal is to address the dental and jaw issues during early childhood to eliminate or reduce the need for more invasive treatment later. These appliances are worn at night until puberty, and the earlier the better. The ideal start time is when the first adult tooth is breaking through. It may not eliminate the need for orthodontic treatment in all children. However, it can substantially reduce the amount of time that is needed and may make your child suitable for a simple course of 6 months of Invisalign, for example. If you would like more information, we would like for you to complete the sleep and speech questionnaire that is found on our website. And also, please review the oral health group article that is linked on the page. We look forward to meeting you to discussing Healthy Start with you and your family, and hope that this can be a great treatment option for you to preventing future, more invasive treatment for your child.